His music, his way. Tivoli Foundation Gala presents Charlie Crockett, Friday, November 8th at Soldiers and Sailors Memorial Auditorium. Tickets on sale now at TivoliChattanooga.com.
Okay, you look ahead at our weather pattern for the next several days, and it's nice sunshine. The weather's going to beckon you outside, but gone are the poolside days. For most of us, we're kind of saying aw shucks, but not if you're Dr. Luke Maxfield, who is here with Aspire Dermatology and Skin Surgery Center. This is Bailey Goss, and they're going to make the glass half full for us this morning because the summer tanning days are gone, but this is when you take care of your skin. Is that right?
That's perfect. That is perfect. So one thing that most people don't realize is that during the fall and then subsequent winter, this is your time to aggressively treat things like fine lines, wrinkles, dark spots, redness, tone, but the most common request we get is certainly for hair removal. So hair removal can be done a few different ways. Classically, we'll use different light or laser devices, and this can be a permanent solution to that unwanted hair. Now, I do have a couple pictures for us today, and we compared an over-the-counter product, which the technology is really improving, and then the in-office treatment. And just take a look at what actually happens when you use them. So this is, we're going to go with the in-office first. This is the in-office device. So we use an IPL. You'll also maybe hear the term BBL, but this is where you used a very selective wavelength of light to target the hair shaft, or not the hair shaft, sorry, the follicular unit, and just really get rid of it permanently.
So now, is what I'm looking at there like a really up-close view of skin? Yes,
sorry. So on our left, there is hair. And let's say before treatment, this was just confluent hair on a part of an unknown person's body. This may or may not be me. And so that is the non-treated section. And then we have the treated side where we're only halfway through the treatment here, and you can see that the hair is very much gone, almost no regrowth already.
Yeah.
And so this is a really good result and pretty much an expected result.
Okay.
Comparing that to the at-home option, which again, I'm a big fan of at-home treatments and at-home things. That's why what we talk about regularly is what you can do at home, and I'll try to empower that.
Yeah.
And so this is one of the leading devices, and I do think that as technology and safety improves, people are going to have more options. But even with this, it's not quite as strong. The arrows I put there are pointing towards regrowth, even though this is also a semi-complete treatment. So if you want to do something at home, God bless. I think there are safe and effective ways to do it.
Right.
But I do still think that the in-office treatments are far superior for that.
Okay.
And
so is Bailey is like the resident expert on the hair removal, is that right?
That's exactly it.
So let me ask you this, Bailey. Are most people coming in wanting it on their, is it facial hair, a lot of it, like for women as we age? Or is it like arm and leg hair?
It's kind of a little bit of everything, honestly. So I do get a lot of women that come in with some concerns about different areas of, mostly kind of the chin area where they'll have hair growth. So I have done some treatments there. But a lot of times I will get underarms, that's a big request, as well as the bikini area and legs.
Okay.
So it's kind of those areas primarily. I've gotten some for back as well. You know, kind of everybody's different. So you can have just darker hair that you don't want. We can't treat blonde hair. That's one big thing, because it doesn't pick up pigment. So the treatment is actually targeting that hair follicle, but it won't really target it if the hair is blonde.
So when you're doing it in office, that was the primo way to do it. What are you doing exactly?
So when you come in to see me for an appointment, I'll do a quick consultation because we base all the settings of the treatment on your hair and skin type. So it kind of depends on the area of the body as far as how long it'll take as well. Typically 15 to 20 minutes. They're usually pretty short and sweet. I do ask that you shave about 24 hours ahead of time. It's different from waxing where you don't want to shave, but you really within 24 hours of your appointment time is best. I don't mind shaving you, but I prefer not to. Pain level, it kind of depends on the area of the body. Dr. Maxfield can give you a better idea of what the pain level's like. But yeah, they're pretty short and sweet appointments. So.
And once you've done it, that's it? Like it never comes back?
You do have to do a series of treatments typically. A lot of my patients have seen results from the first treatment. I've also used it before and I saw results from the first treatment. I did it on my underarms and I got great results from it. But a lot of times we do recommend you doing a series of treatments. It typically is about 6 to 10 treatments and you'll usually do them about once a month.
So sorry, but on your underarms, for example, are you going in there and you're like just plucking the hair out?
No. So if you're shaved, so typically, ideally, if you're shaved, then there's no hair on the surface of your skin if it's a fresh shave.
Right.
So what we'll do is the device is like a pulse light, so it almost looks like a camera flash when you do it. So I'll give you some safety goggles, and then we'll do it. We'll kind of go in like a series of kind of like a stamping motion. And you'll feel a little bit of a sensation of where it's targeting those hair follicles, which is why I said kind of the pain level depends on the area of the body, kind of where you're sensitive, and also what your own pain tolerance is. But usually, especially in the underarms, I personally didn't find it super painful just because it's such a small surface area.
Right.
But you'll usually just stamp it, you'll see those flashes of light.
And then what's making the hair come back? Like, why is it not coming back?
So the hair follicle it can start to develop and grow back over time. But the more treatments you get, that's usually why we recommend a series. The more treatments you get, the more it destroys that hair follicle itself and prevents it from coming back. So that's why it's a more permanent solution versus shaving.
But it's not bad for you to do that?
No, it's very selective. So there's something called a chromophore, and this is a substance in our body that maximally absorbs a specific wavelength of light. So for UVB, that chromophore is DNA, which is why UVB from the sun can cause cancer. For different colors, in this case, let's say dark black, brown, we use a specific wavelength that will be absorbed into specifically the hair follicle. It destroys that permanently over time, and that's why you get a very selective treatment that can hopefully spare the surrounding skin, but treat and remove the hair. And then also too, our trajectory over time is we will grow more hair in places, so there is, sorry, the mic, but there is maintenance that you will need after this. So you get the series of treatments, get a great result, and then over time you will need maintenance throughout life.
But for some people, I have to wrap it up, but for some people, they have maybe excessive hair growth. I mean, it's a lifestyle impact for them,
Oh,
right?
absolutely, yeah.
And so that's why you're doing it. Is that right?
Oh yeah, it can be. Look, my statement is, if it's important to you, it's important to me. And so for whatever the reason that you want to get this treated, we're happy to come alongside you and do it with you.
And before people get mad at me for saying go poolside and then we're talking about removing fine lines and wrinkles, I totally realize the hypocrisy of that statement. However, you all know it's also true. Here's where you'll find them: Aspire Dermatology and Skin Surgery Center. They're in Saudi Daisy. 712-9301 is the phone number. AspireDermatologyTN.com. Ask for that appointment with Bailey or whatever your skincare needs. Dr. Maxfield will be happy to help you. Good to see you.
Awesome, perfect, thank you.
Thank you.
Come be a part of our family tree at Martin Boyd Christian Home, a nonprofit assisted living community. A family makes a house a home, and we value your family like our own.